안녕하세요. 몸, 마음의 성장을 돕는 오알프 치과 오경아입니다. 오늘은 한국에 굉장히 기쁜 소식을 알려드리고자 합니다. 알프를 창시하신 데릭 선생님을 모셨고요. 놀드스타 아카데미를 창시하셔서 알프 테라피를 가르치러 와주시는 모나 선생님을 모셨습니다.
안녕하십니까. 저는 미국에서 치과를 하고 있는 닥터 모나 모이라고 합니다. 지난 4, 5년 동안 한국에 알프 테라피를 가르치러 열심히 1년에 몇 번씩 왔다 갔다 하면서 한국에 있는 치과 의사 선생님들과 교육을 하면서 여기 닥터 경아 선생님, 오알프를 하고 계시는 경아 선생님을 만나게 되었고요. 그리고 이번에는 알프 치료를 창시하신 닥터 다릭 노르스트롬 선생님을 모시고 왔습니다.
사실 알프 테라피가 일반적인 교정과 다른 부분들도 있는 것 같고, 이것을 보시는 분들이 그럼 도대체 알프 테라피가 뭐예요? 를 가장 궁금해 하실 것 같아요. 그래서 제가 이렇게 알프를 창시하신 데릭 선생님께 감히 알프 테라피가 뭔가요? 를 여쭤보고 싶었어요.
Could you please tell us, people in Korea and the world,
Yeah.
from your own way, what is ALF therapy?
Well, from the time I began my professional career, my goal has been to honor the individual. The individual, I felt like each person has so much potential, and so I looked for the types of treatment in any form of dentistry that would, what is now known as minimally invasives. In fact, I was a pioneer in what's known as minimally invasive dentistry. But that's what we did with ALF therapy. The idea was to understand what the body really wanted, what were the missteps, and then create an environment through the appliances that would allow the body to complete the missteps, to grow on its own. Not something that I forced it into, but something that I encouraged from that patient. And in designing that, and then placing the appliances, we saw miracles. Like most people know about the miracles, they're still to this day. Then the question was, why the miracles? Because they were even beyond my expectation. And that has led to us gaining so much more understanding of human nature. And so now it's called the ALF resilience model, which is what you're embracing in your practice. And it's recognizing the potential of each individual, understanding what's missing for them to reach their potential, and supporting them to reach that. And so the appliances are designed to be minimally invasive and to very subtly trigger or support natural processes that lead to this beautiful facial growth, which is what people see, but it's the personality change, the resolution of seemingly unrelated health problems. And you could probably say some of those health problems, and some of them are really big issues right now. That's part of the reason I'm excited, even though I'm older, to be a part of this movement that you've started here, and because the need is so great worldwide, and the old things are not getting the job done. But ALF has always been about the whole approach, and it's getting the job done.
저희가 충치 치료만 하고 잇몸 치료만 하고 치아만 가지런히 하는 거에서 멈춰 있을 수 있는데, 사실 제가 알프 테라피를 하고 있는 것 자체가 환자분들의 몸, 마음을 성장시키는 데 도움을 드리지만, 저도 이 치료 과정을 하고 있는 중에 저 또한 환자분들을 통해 가지고 계속 몸, 마음이 성장하고 있고, 또 이렇게 좋으신 선생님들을 통해서 공부하고 있는 과정조차도 저의 성장이 굉장히 도움이 되기 때문에 삶의 의미가 있구나라는 생각을 하거든요. Thank you.
Yeah, thank you.
Yes.
그래서 저희가 데릭 선생님께서 알프 테라피를 창시하셨잖아요. 그런데 왜 한국에 오셨을지, 왜 그 수많은 150개가 훨씬 넘는 나라들 중에서
네.
Why Korea?
Well, as you mentioned, I was nervous about coming. I was nervous about spending the time away. It was kind of a sacrifice, but it was amazing to be in Korea. I found people were uniquely both caring. There's overall almost a sense of family for a whole country. And that's pretty unique. And it's that family. A lot of the success of ALF relies on communication, deep communication beyond just measurements. And that sense of family, I could see that playing into your success with ALF therapy. Therapy is well known worldwide for miracles, but part of that is from this communication beyond just measurements. And I found in Korea that people were both friendly and caring enough to take really good care of the environment, caring enough to, I believe that your country is interested about the future, neurodegenerative disease like Alzheimer's, that kind of level of caring, and at the same time a sense of precision. When I said something, you listened and you paid attention to it. It was absolutely mind-blowing because there were so many of the details that you picked up on that are part of the success of ALF therapy because it is so comprehensive. So it was very easy to want to come back again. Well, just like she was saying, the more she learned, the more powerful she was. But I mean, she didn't say that of herself, but yes, I know she is. I know she's very effective. But she spent the time to go home and keep learning. She didn't just go learn some little thing, do that, and oh well, did it work? You had that level of concern and care that you really worked to learn it, and it shows. And I don't want to turn that down. Someone that's like that, I'll pretty much go across the world for that because you're the one that makes the change, where the people feel it, and all it takes is a few people experiencing what you've experienced, and there will be more, and we need that. And so for me, like I said, it was hard to turn that down because of the power of your character and the strength of your desire and how much you're learning. And it's transformational. Like you just said for yourself, once a practitioner will put that effort into it, they start to transform themselves. And their power to help other patients transform continues to increase. It's hard to teach that in a weekend, or you can't teach it online, but to be in person and to both experience it, see you in action, and then watch the results. It's infective, I guess, in a way where you don't want to turn it down. It was easy to come back because of that.
제가 10년 됐어요, 알프 테라피를 배운 지. 근데 약간 저의 꿈이 이루어진 순간이기 때문에 너무 감사하고, 어떻게 보면은 제가 감사한 만큼 저희 한국이 정말 한국 사람들이 이렇게 이 좋은 진료를 잘 받아들여서 한국 사람들이 많이 건강해졌으면 좋겠고, 사실 몸이 건강해야 마음도 건강한 법이거든요. 그렇죠. 그래서 너무 감사한 마음을 잘 받아서 저희 선생님들도 그렇고 저희 환자분들도 그렇고 이 마음이 좀 잘 전파됐으면 좋겠다 하는 게 저희 입장입니다.
So that's in the same token, what would be not the advice, but something that you wanted to tell public, patients, parents who's seeking the care for more holistic care, not just the straight T's. Is there anything that you want to share?
Well, there are a lot of choices, and it's good that people have choices. My concern is that people just tell the truth. And we learn here, this group is committed to telling the truth, but not every group is. And so to the parents, I would just say, you need to listen to your heart also, because there will never be enough information. These are hard decisions to make. It's your child's future or your future. I know, and that's the reason I'm willing to come here, is I know but their heart is totally committed to that. We struggle over every single little thing because we care so much. And so people can feel that. So if they listen with their heart, they'll know that this is the track, and then stay on it until you get until things complete, because there is a process of growing. There are missteps. Everyone has missteps or they wouldn't need the care. And because they have the missteps, we're looking for those missteps, and some of them reveal themselves in little steps along the way. And yet it all works in harmony, or you wouldn't be doing this. This is hard work. And we are constantly listening deep into our heart and researching and everything to find answers to some of the very challenging cases. We had them in this recent group study that we did, some very, very challenging cases, and we struggle over those, not to find the solutions, but to make sure that the solutions are the very best for that patient. And that's the level of care that we have for you as the parents, and I'm sure you could feel that. But when you go and look at your choices, also listen to your heart, because you'll recognize the difference.
항상 닥터 노스트롬께서 늘 세미나를 하시고 마지막에 하시는 말씀이 꼭 있어요. Choose wisely. 의사로서 우리가 환자를 치료할 때도 우리가 사용하는 그 방법이나 기법들을 choose wisely, 현명하게 선택을 하고, 환자분들이나 부모님들이나 치료를 받으시는 분들도 listen to your heart. 왜냐하면 마음으로 들으면 진실을 들을 수가 있어요. 그래서 그 진실을 듣고 치료를 포기하지 말고 서로
네.
의사도 환자도 같이 하면서
네.
나아가는 게
네.
모두에게 드리고 싶은 말씀이라고
네.
하시네요.
저희가 이렇게 알프 테라피를 창시하신 대릭 선생님 모시고 인터뷰를 하지만, 사실 저희가 모든 사람한테 환자분이 딱 오셨을 때 알프 테라피 바로 시작하자라고 얘기하는 거 저희 아니잖아요.
그렇죠.
사실
네.
몸을 공부하다 보면 처음에 오셨을 때 이 환자분은 주 원인이 아무리 봐도 골반이 좀 틀어져서 문제가 다 치과적으로도 발생을 했구나 라고 한다면, 그분은 골반을 고칠 수 있게 환자분을 다른 곳에 치료할 수 있게 소개를 시켜드리고, 또 발이 문제면 발을 고칠 수 있게 시켜드리지, 처음부터 오시면 자 알프 테라피 다 하자 라고 저희는 절대 그렇게 얘기하지 않거든요.
그렇죠.
그런 부분에 대해서 한번 말씀 좀 해주세요.
사실 우리가 환자분이나 본인이 볼 때는 대부분 교정을 하러 치과 의사로 오죠. 대부분의 경우에는.
네.
요즘에는 이제 이 알프 테라피가 외국에서는, 이제 미국에서는,
네.
제가 있는 곳에서는 더 많이 알려져 있기 때문에 제가 굳이 거기에 대해서 설명을 안 해도 알고 오시는 분이 많지만,
몸과 치아,
그러나
치과적으로 연결되어
네,
있다는
그리고
부분을.
저는 아이들을 많이 보거든요.
네.
왜 아이들을 많이 보느냐면, 교정을 잘못해가지고 고통을 받으시는 분들이 너무 많아요. 나중에 처음에는 모르지만 세월이 오래 흘러가지고 그걸로 예를 들어서 뭐 헤데이크가 있다거나, 아니면은 말로는 표현할 수 없는 증상 하나가 아니라 증상이 여러 가지신 분들이 많이 오시거든요. 그랬을 때 그런 분들을 보이는 거는 치아잖아요.
네.
보이는 게 있고 안 보이는 게 있잖아요. 그러면 우리가 볼 때는 보이는 거를 치료해달라고 오지만, 이 알프 테라피를 공부하신 선생님들은 그 보이는 게 잘못된 거는 증상의 하나고, 왜 잘못되기까지의 그 뒤에서 일어나는 일이 뭘까?
그렇죠. 저희가
그거를 배우는 거죠.
히스토리가 어떤 분은 30살에 오셨지만 5살, 6살 때
그럼요.
뭐 넘어지면서,
아니면 태어나서부터,
네.
아니면 임신을 한 상태에서 말하자면
엄마의,
태어나기 전부터 시작을 하는 것이기
네.
때문에 이 알프 테라피를 배우는 거는 단지 그냥 눈앞에 보이는 것만 보는 게 아니고, 여기까지 오게 된 상황이 무엇이었을까. 그래서 저희들이 아이들을 치료하는 거를 많이 권해드린 이유가, 이 시간이 짧을수록 우리가 더 빨리 도와줄 수가 있잖아요.
그렇죠.
그러면
어린아이일
그렇죠.
때 알프 테라피로 이렇게 도와줄 수 있으면
그럼.
아이가 계속 건강하게 자랄 수 있을 거예요.
그렇게 되면
더 건강하게.
그렇죠.
네.
그래서 이 알프 테라피의 모토가 뭐냐? resilience. resilience를 한국말로 뭐라고 하나요?
회복 탄력성이라고 얘기하면
회복
어떨까요?
탄력성? building resilience. 그게 알프의 모토예요.
And empower?
Empowered doctors and patients to build resilience. 그래서 아이가 넘어지면 다시 일어나서 갈 수 있게.
저희가 넘어지지
넘어지지 않을 수는 없죠.
넘어지지 말라고 하는 게 아니라 넘어져도 다시 일어나서 건강하게 걸을 수 있게. 그러니까
그렇죠.
건강하게
그게
더 살 수 있게.
의사로서,
네.
부모로서, 의사로서 부모로서, 선생님으로서 할 수 있는 게 바로 그런 거라고 생각을
네.
하고, so for Dr. Nordstrom, we're just talking about, we can talk about it forever, but we want to build the resilience and start early to help children to grow happier, healthier, more resilient adults. And that's what we want to do, right? So for this time, I think we just want to thank you. Thank you from our heart.
It's an inspiration. More will come.
Thank
It
you.
keeps coming as long as you keep
Yeah. Learning.
you're learning.
Yes.
More comes. It's absolutely amazing. It's almost
Yes.
like being tapped into an infinite well.
Yes.
of
Infinite
information.
possibilities.
Yeah, and
Yes.
it's from this harmony.
Yes. Thank you so much.
And now we have the support to really create sound foundations for every practitioner. And what I would say is that those that are beginning recognize that you can still have great success.